I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change, and these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon. Welcome to CEO Live Talks. I'm your host, Dr. Swannie Jett, and today I have the pleasure to have one of my good friends, Miss Katie, to the show.
How are you?
I'm doing pretty good today. How are you doing today?
Can't complain. Trying to get over the Derby tiredness, but we're getting there. We're getting there.
Yeah, so before we get into all of the Derby festivities, you've had a great year, but, I want to talk a little bit about your background and your upbringing.
Okay. All right. Well, I have come from a family of tourism and hospitality professionals. So I grew up, my mom owned her own business, a small business, and my dad was in the restaurant business at a district management level. And so hospitality, customer service, I really learned from them and the exposure that they gave me. But more than that, my grandfather was actually in the tourism commission business. And so basically he worked for a marketing organization for the community. Mm-hmm. And as a kid, needing a babysitter and trying to get out of the house, my mom would have me go with him to work. And the rule was if I made a peep, I was in trouble.
Okay.
So I quickly learned early on how to be a silent observer.
Okay.
And I learned so many important life lessons from him, but really the art of hospitality and welcoming people, being exposed to a variety of backgrounds and cultures because they were visiting our community and sharing those stories with us. So that kind of morphed into what am I going to do with my life in college? Honestly, I thought I'd go into forensic science, which I know is literally the polar opposite.
Polar opposite. Polar opposite.
Tourism. But I came to a point when I was given a health diagnosis that was going to not allow me to do what I kind of projected for my life. I suffer from pretty serious rheumatoid arthritis. Okay. And so I kind of had to pivot. It was an early life lesson to learn to pivot very quickly. And he brought me along, exposed me to a couple people. I did some internships, worked at the Louisville Tourism Bureau, and just fell in love with hospitality and tourism.
So you had a family that was in the business sector. So where did they grow up at?
So my family is originally from Louisville, and my grandfather actually lived and worked in Bowling Green for a period of time. And I say he is the guy that has literally had every position and every job. He's sold country hams, sold cars, was a teacher at Fern Creek High School, actually. Okay. And then he decided to take the career path of hospitality and kind of created the position that he was in, and I just kind of followed in his footsteps. So my family is originally from Louisville, but I actually reside in Shelby County, and that's where I grew up. And still live there, actually.
So any siblings?
I have one brother.
Okay.
Yeah, we're 10 years apart, so it's like an only child in both sectors.
Right, because it's hard to have a connection 10 years apart.
Yes.
So you have to develop it as adults. But growing up, because I have a sister, we're 7 years apart.
So you know.
So yeah, as we have gotten older, we've developed a relationship. But younger, 7 years apart, I'm 14, she's 7. We're doing different things.
That's exactly right. So we're good friends now, but it was a little difficult growing up. By the time I was in high school, I was on dance team and did a bunch of different things, and so I was in one direction, never wanted to be home.
Right.
Who wants to be home as a teenager? Couldn't wait to get that driver's license.
Right.
So yeah. So 2 only children, basically.
All right. So where did you go to college?
I went to U of L, of course. Go Cards.
I didn't know. I just assumed you might disappear and go to the UK or something.
Oh, no. Although I do have to say, I'm a diehard Cards fan now, but I grew up in a UK household.
Okay.
So it was, I'm the black sheep of the family now.
I'm sure. That's a house divided.
Oh, yeah.
Your father, your mother looking at you, and your grandfather.
Yeah, that's right.
All right. So you were diagnosed with rheumatoid arthritis at what age?
So they kind of couldn't quite figure out what was going on with me when I was in college. just told me that I had, it's called hypermobility. And basically just means that your ligaments and joints are not tight enough to hold your skeletal case. And it wasn't until I was in my mid-20s almost before they officially diagnosed me, because all of my blood work said that I was not RA positive.
Okay.
So it was interesting, that journey. It's kind of frustrating when you don't know what's going on with your body. You're not in control of what's
Because
going
usually
on.
hypermobility, you flexible in a different way too.
Right.
Right.
Right. Yeah. So that diagnosis was, when you read about RA and what your life could look like, it's pretty devastating.
It is.
I've been pretty lucky though. I've never let that. I've always said it could be worse. I could have something else.
Well, especially you're talking about in college, because usually that kind of diagnosis, really people in their late 60s and 70s, you see it most so.
That's right. And what they're seeing right now is that more and more folks younger, they're finding that they have rheumatoid or osteo, which is
Right.
crazy, because that is certainly when you're older in life.
Yep. Well, they don't teach as much about proper standing, posture. And I see now, and I'm always fearful of this, I see now where we are overutilizing our kids' joints. So, because we're putting them into sports at a younger age. So I'm coasting mine now, but I understand that if they overuse it, they'll be done by college.
That's right. And so honestly, dancing was probably the worst career I could have had, to be honest. You're using your entire body, but I certainly loved it, and the freedom of expression that it gives to people, the interpretive nature that you can share with folks. It's pretty deep thinking there. Yeah.
So how have you managed since then?
I've been really, really lucky.
And I'm assuming, I'm saying you're still 25 years old, so I ain't going to tell nobody.
Yeah, that's right. I'm 25. That's right. So I've been really lucky to have a group of doctors. I finally changed from a different practice and found a lady. I believe wholeheartedly that medicine is both Eastern and Western. And there's a balance to, good eating and what we're putting in our bodies and how we treat our bodies, as well as knowing that we need medicine sometimes to make us better. So I've had the privilege of being under really good care with Dr. Leone, and she has provided a good balance to me. She listens to me when I say, hey, I think this could help me. Let's give it a try.
You said something important. She listens to you.
That's right. That's right.
Because you found a lot of doctors do not listen.
And that's where I was. Yeah. So we parted ways, and I found her. It was amazing to find her in her practice. And so, yeah, it's been pretty good.
I tell people all the time, it's no different than owning a car. The person that's driving the car knows the car better than anybody else.
That's right.
So if I bring the car to the shop, you might want to listen.
That's right. And I can't stress enough that people need to advocate for themselves.
Of course.
Unfortunately, with all of the sophistication of our systems and the great work that they do in helping us as patients, they're also not communicating on cross systems sometimes.
Right.
And so for whatever treatment that you are seeking, really consider what that doctor's going to do for you. Consider balancing a variety of paths to healing. And that's kind of what I've done. It's taken years to learn to advocate for yourself, but listen to your body. What's going on.
And not only that, you have to have somebody to advocate for you at times.
That's true.
Because you might be in a position that you're in a hospital. And I see a lot of times with patients going to a hospital or family members, there's nobody advocating. And so, if it's my family member, I show up.
That's right.
And I saw this really during COVID. It probably was the worst time to see it, because patients would go to the hospital and, their family member couldn't get in at sometimes. And if they did, they didn't know what to say.
That's right. And I will say, I'm not going to get on a bandwagon here, but I will
Don't
say.
Get on the bandwagon. Get on the bandwagon.
The healthcare system is extremely difficult to navigate.
Oh, yes, it is.
And for so many people, healthcare is so out of reach financially. And if you don't know how to navigate those systems and you don't know what's available to you, I know this is more about me and my career, but my husband just successfully beat cancer last year. And had I not had the experience in navigating our healthcare system and what could happen and what was available to him, it's almost like going to school to learn
it is.
what
You need a manual.
That's right.
And even the manual, that's theory, but the practice is different. And then you have to go learn. So it's almost like a life lesson there, how to navigate the system.
Yeah, and to your point, everybody needs an advocate, even if it's just a friend to come along with you. You hear things differently, and so you need that advocate with you to make sure that they pick up on
Well,
things.
also people, the nurses, the doctors, they respond different when there's somebody right there in the room monitoring and watching.
Isn't that funny?
It's different, but it's true. It's like, what are you doing now, and why?
Yeah.
Because that makes people think. It's critical thinking, which I've been on my tangent about that recently, about everything. Because sometimes people just do things that don't think.
That's right. That's right. And, maybe the quickest path is not the right path.
Right. Hello, I'm Dr. Swannie Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you.
Hi, I'm Destiny. I'm the Community Health Workers Manager here at Park Duval Community Health Center. This is my team of community health workers.
Community health workers close care gaps, reduce barriers to care, and address health disparities in our community.
Community healthcare workers act as a bridge between the patient and the provider to stay engaged in the healthcare plan.
CHW strives to work as committed care team members for PDCHC, for current patients, and to provide access to those who need a new medical home. For more information, please visit pdchc.org or visit one of our centers. Thank you.
So, that was a difficult, so you're dealing with your medical issue. Luckily, you were able to overcome it, but, how did you help your husband through that?
Oh, gosh.
And what kind of cancer did he have? Because I'm sure that had to be a life scare as well.
Yeah, so he's under 40 and never expecting to hear that diagnosis. He had some issues, but colorectal cancer is on the rise. It is set to rise over 50% over the next 5 years. So, and it's predominantly in people under 40. So he had, like I said, had some issues, and typical man didn't want to go to the doctor. So
Let it persist for a while.
It persisted for a year.
Wow.
Before he finally decided to go to the doctor. And we're just so lucky that it was caught early. It was caught in between stage 1 and stage 2.
That's good.
He had amazing doctors in the Norton healthcare system. And we were able to beat it. And
the key to it is it was a stage 3 or 4.
That's right. That's right. And the good news is, in thinking about it, because the likelihood of all of us having cancer one day is increasing each day.
Well, it's because we're living longer.
That's right. That's right. So there are so many tools out there. There's just so much great science out there. And again, got to have that advocate, got to have that support system.
And you got to have a little bit of knowledge on research. I always said, before you go see a doctor or you get a diagnosis or you need a screening, do some research.
Yes.
It's important for people to become health literate.
Maybe do the right research, I'll say.
Well,
Google is not always your friend.
Well, Wikipedia is needed. So you do get to go to trusted sources. So I always advocate CDC, the health department.
That's right.
Go to trusted sources.
That's right. Yeah. And people are, to your point, living longer every day. And so I think the most difficult lesson for us to overcome is cancer is not a death diagnosis.
Right.
And
No,
I wish
it's not.
more people talked about that. It is a disease that many of us will have to live with in our lifetime.
But now probably the first thing he was thinking, and I'm sure you would think, it was my diet.
Yeah.
Because they always say it's your
Yeah.
diet.
Yeah.
Right? But I'm pretty sure his diet probably wasn't that bad.
Well, you know, we all like to have a good time. We travel a lot. There might be some libations involved.
I don't know if I don't know if that creates.
But no, to your point, it's really not only the food that we put in, how we treat our bodies,
Right.
the environment that we expose ourselves to, all of those things. And so we've been kind of on a learning journey as we have moved through this entire process as well.
No, and it's probably, you know, people don't change unless something significant happens.
That's right.
And I study behavioral health, and it's always interesting that, you know, people stop smoking when they get a diagnosis. You know, if people need to exercise, doctor could tell them for years, and then they get a diagnosis of diabetes or something. They're like,
Yeah.
I might need to really change. So it's very difficult unless something happens. But once it does, if it's caught early enough, you begin to make that progression.
It's made great progress for our family unit. So we have 2 children, Sophie 12 and Dominic 9. And they have certainly, we think about what exercise have we done for the day. If we haven't moved today, then it's on our calendar to do something, or what are we making for dinner? All of those things, it's just a different lens to think through.
It is. I fuss around my house a lot about no snacks.
Oh,
I
yeah.
limit the candy.
You gotta have a little chocolate every now and then.
Every now and then, but if my little ones have it, they'll do it every minute.
Well, that's the joy of being a kid, right?
It's like, yeah, let me change these habits now. So you go to U of L, you're thinking about forensic science, and then, you know, what changed it? I mean, I know the RA changed you, but you had to make that transition first.
That's right. So,
And you couldn't just go back and realize, you know, your family's doing one thing, and I find a lot of times people want to do the opposite of what the family is doing.
that's right. That's right. I have to say, I've always had a really good support system. You know, my parents, even though, you know, we made a decent living growing up, it was not, they tried to expose me to things, but as a small business owner, you know, we didn't travel on spring breaks. We didn't have a lot of family vacations because we were serving those that were coming in, the clients coming in. So we had to be available to them. And throughout that entire process of college, my mom and dad were we want you to get an education. We want you to strive and for your goal, but whatever that goal may be, that's your goal. That's not our opinion. And so I have to say that my parents have always been very supportive and very laid back of whatever I wanted to pursue. And that there's some liberty in that.
There is a lot of liberty because a lot of parents don't do that.
That's right. That's right. And that gave me the opportunity to go back to school, and I was an undecided major for a whole year. And for my goal-setting self, I mean, an achiever is in my strengths-finding nature as a top 5, as well as competition, by the way. So not to have a direction was a very difficult life lesson. And it wasn't until like really now, later in life, that I should have relished that opportunity a little bit more, should have said yes to a lot of other things. But while going through college, I just kind of did my general studies. And I had a professor, I took a comms class, and I had a professor that was like, you know, I think this is kind of what you should think about. There's so many options in communications. You know, I love to speak to people. I love to be the expert in the room on a topic. I love to engage with people from all backgrounds. I love to travel, all the things. And she said, you know, you're hitting all the boxes here with communications. You could do literally anything. And so I switched my major that year and almost went on a trip to Brazil to do some healthcare communication.
Oh, wow.
And unfortunately, I don't even remember what it was that got in the way and didn't get to take that trip. And that's one of my greatest regrets. I think my career may have gone in the healthcare realm had I taken that trip. But now I'm in tourism, and it's one of the best industries in the world.
You know, that's the interesting thing, availability opportunities. So my wife works in communications and marketing and came from public health background.
Okay.
That's what opened up the gateway for her.
Yeah.
So she was a natural talker, reporter, And sometimes that's your chosen field.
That's right.
And a lot of people don't recognize you take on a skill set, but what you have a passion for is what you'd be great at.
That's right.
So it's never too late.
Well, I don't know. I feel like I found my niche here.
It's never too late. You could always, do public speaking and public relations.
Well, that's the
when you're at
beauty. I
top.
get to talk about how great the museum is all the time.
Right. So transition me to, what occurred once you graduated.
So
what was your first job? And because that shapes you.
Oh, absolutely it does. Well, I have to say Louisville Tourism gave me an exposure to corporate world. They are, at that time, they were known as the Louisville Tourism Bureau. And now they, I think, transitioned to Louisville Tourism as a whole. But they ingrained in me kind of business in general, acumen, business culture. Again, coming from Shelby County, it's a very small town, relatively speaking. That's true. It's growing every day. And I just really, really loved tourism, but I wasn't sure I wanted to work in that kind of corporate culture. It just felt foreign to me at the time. And so I took a chance and worked with the Shelby County Tourism Commission, as it was known at the time. My grandfather was still working there at the time, so might have had a little help.
Right.
But the board was so impressed with my internship that they hired me as basically like an office manager / assistant marketing person. Again, very, very small commission at the time. And we were a part of economic development as a whole. So the Economic Development Office, the Chamber of Commerce, Main Street, we're all in the same building together. So I was getting pockets of information from all those people and learning from people that had been in their careers for a long time, all the way to some folks that were young. And again, when I say a small office, it was 10 or less.
Oh,
so you
I'm
get
from
to
me 'cause
learn.
I've been there.
You get to learn interactions with people and navigating social norms and business all in one in a very small space. So a lot of good life lessons on how not to act.
Hello.
Not to act. And eventually, I just speaking with the board, again, they were impressed with my marketing prowess and some of the communication stuff and cleaning up some of our policies and procedures. It's quasi-governmental, so there's a lot of boxes to check.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park Duval Community Health Center. Ever since I started at Park Duval over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hello, I'm Dr. Swannie Jett, CEO for Park Duval Community Health Centers. We conduct WIC, nutrition, and open enrollment for healthcare. So this is a one-stop shop facility for everybody in the community. And that was one of the lessons once I became a CEO. If I spoke in the meeting first, nobody had an opinion.
That's exactly right.
So everybody did exactly what I said. So I never was able to get any thoughts. And if I was sitting in a room with a lot of other CEOs or types, I would just sit and be quiet because they'd be going into areas that I'm the expert in, but I want to know what their thoughts were. Plus also I want to gauge on how much they actually knew.
Well, that's a good point. It's something that when you sit in a room with experts or authorities of any kind, not only do you learn, but then you find a way to mesh all those opinions together. And as leaders, that's our job, right? Mm-hmm. We are set to not always be the smartest person at the table. Our job is to be smart in acquiring the right talent around the table. And that's one of the things I think moving into, I will say, to the mid part of my career, and I'm in those early stages, of course, but now I don't feel like I need to know it all anymore. And that's taken years to really be comfortable in not being the person that knows the next step.
Well, the thing is, being a leader, being the CEO, VP, your job is not the doer anymore. See, a lot of people get that confused. Yeah, I could do epidemiology. Yeah, I could do public relations and marketing. But my job is to assemble the right talent
That's right.
to do those jobs.
That's right.
Have knowledge about what they're doing, but I don't need to execute.
That's right. And for someone that is that achiever mentality, that is still
It's
difficult
hard. It's hard.
sometimes.
It's competition.
Sometimes you got to sit on your hands a little bit. But I'm so proud of the work that I accomplished at ShelbyKY Tourism. And I'm so proud of the team we are building at the museum right now.
So, highlight what was the top thing that you did? That was your footprint, because the standard that you set or what you accomplished propelled the next job.
That's right. So when I started, we had about $140,000 budget.
Okay.
It's not a lot of marketing funds when
I
you're
could blow that in a couple.
Yeah, can't we all today? That's pretty easy to do. But something that no one likes is taxes.
Right.
But for the Bureau to continue to be a marketable product, to compete against the Louisvilles and the Lexingtons and quite frankly the world, because we were no longer selling to Kentuckians.
Right.
We were no longer selling to folks in the US. We were selling internationally. Come visit ShelbyKY, because not only are we the saddlebred capital, we have bourbon, we have all these things. We have small town Americana,
Right.
which is for a lot of people
They want that.
internationally, they want that.
They want that.
They want to see that ideology of what America used to be like
Right.
in the South. So we were able to pivot everything by employing a tax. And I think my proudest moment is not that we passed a tax. I hate the tax. I still pay the tax. But it propelled the Bureau forward. But more importantly, I brought together 3 different government entities. Do you know how difficult that is to get 3 different city councils and a commission together?
You know, Louisville went through that when they merged.
I know,
So
I know.
very difficult.
I know.
Everybody wanted their feet them.
That's right.
And
But
they-
selling the message on why tourism is important. Tourism is the handshake in the economic development process. And if you've been around economic development and tourism, you're probably tired of hearing that. But it's the reality. We go on vacations, we fall in love with a destination, and then we come back. And then we have serious conversations with business leaders or realtors or whatever that may be. We figure out, well, I enjoy this destination so much. I want to live here. I want to start my company here, or I want to move my company here. And all that starts with travel.